This year, as a part of CHAMP's first media outreach to help educate the public about migraine disease, we were thrilled to have an interview nationally broadcast during Retreat Migraine with one of our esteemed presenters, Dr. Bill Young. Here's some of what he had to say about our event and migraine disease.
Say, well, what is a migraine, and what's the difference between a migraine and a headache?
Well, migraine is so much more than a headache. There's head pain most of the time, but there are a lot of other symptoms. So the other symptoms definitionally include nausea and light and sound sensitivity. However, on top of that, there are hundreds of other symptoms that people can have, from brain fog to dizziness to confusion to numbness. About a third of people have migraine with aura, where the headache attack is preceded by neurologic symptoms, usually shimmering lights and a loss of vision on one side of the vision. That's migraine with aura. And then the headache of migraine is often, but not always one-sided, often throbbing, often extremely painful. And it does get worse with activity for most people, like bending over or walking upstairs. It's the number 2 leading cause of medically related disability, or disability days, I should say, in the world. So back pain is number 1, migraine is number 2, depression follows, heart disease and cancer follow in terms of disability, not in terms of death. I do want to talk about migraine stigma, which for me personally underscores my mission.
Yes.
Stigma is when society looks down on you for having a condition or disease and punishes a person. It gives people an otherness and then punishes them for their otherness. And I started to study that about 11 years ago, and it just opened my eyes up to what my patients were experiencing. In addition, compounding the hurt of migraine is the hurt of the stigma. And it turns out migraine is heavily stigmatized. Stigma of migraine, this negative attitude, is directly related to the disability. So people who have it worse are stigmatized and punished by society. People learn to hide their disability from migraine. They're camouflaging all the time. It's terrible for the disease, and we get even less resources. I came to realize the only way to change it is to have a social movement. Patients have to drive it, and they have to be willing and able to stand up and say, yes, I take this seriously, and we demand that we get research, we get legitimate care, we get disability rights, we get accommodations because of our migraine. I had the opportunity to help to found the CHAMP, the Coalition for Headache and Migraine Patients, which galvanizes patient groups from all around the country to act as one when that's the best path to take.
How we can join together. Miles for Migraine and CHAMP are 2 wonderful organizations that people can be involved with that will help them manage not just their migraine, but society's migraine and the impact of it.
And then this is a wonderful time for headache medicine. We have 4 new preventive monoclonal antibodies for migraine. The availability of those medicines have dramatically changed the lives of many of my patients. And 3 of them are subcutaneous injection shots that you take every 28 days, and one of them is an IV medication you take every 3 months.
Dr. Young, I want to thank you for this hour, for this information and education and the inspiration that you've provided us, and remind people about the Coalition of Headache and Migraine Patients and about Miles for Migraine. Dr. Young, thank you so much. Good luck with all of your work.
Thank you. It's been wonderful to talk to you.
Our coalition is working together to solve the challenge of migraine and headache diseases and support patients wherever they are on their patient journey.